My name is Dr. Angelo Gousse, and I am a urologic surgeon specializing in prosthetic surgery. Today I will be discussing treatment for severe erectile dysfunction in male. Most notably, I'll be talking about the implantation of the inflatable penile prosthesis. The inflatable penile prosthesis is typically reserved for men who have failed all other treatments for erectile dysfunction. Other treatments, which might include stress reduction, increase in exercise, testosterone replacement therapy, oral therapies such as medications which fall into the category of phosphodiesterase type 5 inhibitors such as Viagra, Cialis, etc. Other treatments for erectile dysfunction in male might include penile injections of various substances that typically are composed in a pharmacy or prescribed in order to be injected directly into the penis. Many men do not find penile injections acceptable as a treatment modality because of associated discomfort. Others do not benefit from penile injections because of the severity of the erectile dysfunction. Vacuum erection devices can also be an alternative, but in severe cases and because of many reasons, many men do not find them to be satisfactory results. In such cases, many men turn to the implantation of the inflatable penile prosthesis. Today I will be briefly discussing the various components of the inflatable penile prosthesis. The inflatable penile prosthesis is an outpatient procedure which can be performed in less than 1 hour with various degrees of discomfort with excellent results. The inflatable penile prosthesis has various components. One component is the pump, which allows inflation of the cylinders within the corpora. By pressing on the pump, the cylinders can be inflated until the penis is fully rigid. As you can see from this video, those cylinders that were fully deflated and flaccid to mimic a deflated and flaccid penis can be easily inflated within minutes merely by pressing on the pump. And then in such cases, once the patient reaches full rigidity, then the patient may engage in sexual activity. Once rigidity is obtained, all the pressure comes from the reservoir, which is placed inside of the body, and the penis remains rigid until it is deflated by pressing on a button located at the pump, causing deflation of the cylinders which are placed inside the penis. The longevity of the device inside the body can be variable, but many patients require a single operation for the remaining of their life. There's no designated lifespan for this device. So many men who undergo this procedure are likely to have this device functional for the remaining of their life. Many studies have shown that although more than 95% of men are satisfied with this device, the satisfaction rate of the sexual partners is even higher. There is a known percentage of infection rate after implantation of the device, but in the hands of most experienced implanters, the infection rate is very low. The mechanical failure rate of implantation of the inflatable penile prosthesis is very low. In select cases, some men may opt not to undergo implantation of an inflatable penile prosthesis, but rather prefer the implantation of what is called a semi-rigid penile implant. We'll take a break and talk about other alternatives for the management of severe erectile dysfunction right after this break.